Hi, I'm Lauri Kane from the office of Dr. Dean Kane. Dr. Kane is a board-certified plastic surgeon, and what we're doing for Jen today to help reverse her aging is Sculptra. Sculptra is a amazing, I call it my fountain of youth, because I truly believe that it has the ability to not only stop aging, reverse aging, and keep you looking young. So what I'm doing right now is applying a numbing ointment to her face. It's a very powerful numbing ointment so that when we go to do the injections, it's a little less discomfort. This is a very powerful type of numbing. We are going to do her face and her neck with the goal that we are trying to firm, tighten, and thicken, not thicken to the point of making her face look fat, but thicken the actual skin so that it has better elasticity to it. So that is the goal of what we use Sculptra for. So Sculptra are injections, but they're not a filler. So that's what gets confusing. And the way Dr. Kane has created his technique with Sculptra, Sculptra will stimulate collagen, elastin, and all creamy skin properties. So we're going to actually leave this on her for a while, let it work and do its magic. And basically, Sculptra is designed to stimulate her own collagen. She's 56 years old. Once you get past the age of 40, the skin really stops producing its own collagen elastin, like when we were younger in our 30s, or even younger than that, even our 20s. So the goal of Sculptra is to stimulate the skin to produce its own collagen, its own elastin, its own healthy skin properties when it doesn't want to anymore. Because unfortunately, even though she looks amazing at 56, her skin doesn't want to produce the same youthful qualities that it used to. So this is to really make her face tighter and firmer. What's wonderful about Sculptra is that by the end of the year, you don't see results immediately. This is something that takes time to see. And so by the end of the year, the Sculptra is actually increasing the collagen over time, and it really stimulates the skin for an entire year. So unlike fillers, which is the opposite, you put a filler in and it looks immediately good, but it's slowly declining, so that by the end of a year with fillers, you're back to where you started. With Sculptra, by the end of the year, she will look younger than when she even started. And we have patients, Dr. Kane has patients coming to him now for over 20 years. So every year we do a Sculptra injection to maintain that ongoing stimulation of collagen, elastin, and stop the aging and reverse the aging. It's incredible. It truly, I know it sounds crazy, but it really is a fountain of youth, and there's nothing that compares to it. Jen has also is very religious about using Retin-A and also doing chemical peels. And the synergy between Sculptra and the chemical peels and Retin-A is that Sculptra is working from the inside out, stimulating collagen, elastin. Retin-A and a chemical peel is working to stimulate the collagen, elastin from the outside in. So the two of them, when you really work at this and you really want to be diligent about really helping your skin stop the aging, when you do both of those processes, Retin-A, a peel, Sculptra together, the synergy is amazing and you get these great results. And so Jen had a chemical peel about 6-8 weeks ago. Her face looks beautiful. And now we're just kind of adding on to her own fountain of youth.